10 key points about hypoglycemia. Definition of hypoglycemia. Hypoglycemia is defined as a plasma glucose concentration below 70 milligrams per deciliter. However, symptoms might not present until glucose levels fall below 55 milligrams per deciliter. Whipple's triad, used to describe hypoglycemia, involves recognizing hypoglycemic symptoms, obtaining low blood glucose levels, and demonstrating symptom relief after correcting low blood glucose. Etiology of hypoglycemia. Hypoglycemia is most common in patients with diabetes who are taking medications like insulin, sulfonylureas, or meglitinides. Drugs are the most common cause of hypoglycemia. Other causes include alcohol consumption, critical illnesses, for example, sepsis, renal failure, counter-regulatory hormone deficiencies, for example, adrenal insufficiency, and non-islet cell tumors. In non-diabetic patients, hypoglycemia is uncommon. Pathophysiology of hypoglycemia. The body has counter-regulatory mechanisms to prevent hypoglycemia. These mechanisms include decreasing insulin production, increasing glucagon secretion, and increasing epinephrine secretion. When glucose levels decline, insulin secretion decreases to allow for hepatic glycogenolysis and gluconeogenesis. Glucagon and epinephrine are released to increase glucose production. In prolonged hypoglycemia, growth hormone and cortisol are also released. Symptoms of hypoglycemia. Hypoglycemia symptoms can be neuroglycopenic or neurogenic. Neuroglycopenic symptoms result from the central nervous system being deprived of glucose and include behavioral changes, confusion, fatigue, seizures, coma, and potentially death. Neurogenic symptoms arise from sympathoadrenal involvement and can be adrenergic, for example, tremors, palpitations, anxiety, or cholinergic, for example, hunger, diaphoresis, paresthesias. Diagnosis of hypoglycemia. Whipple's triad is a clinical indicator of hypoglycemia, and laboratory evaluation should confirm low serum glucose. A detailed history is essential and should include medication history, alcohol or drug use, history of diabetes, and timing of the hypoglycemic episode. Other laboratory tests include insulin, proinsulin, and C-peptide levels to determine if exogenous insulin was administered. Measuring C-peptide is essential for differentiating between various causes of hypoglycemia. A high C-peptide suggests conditions like insulinoma or sulfonylurea use, whereas a low C-peptide indicates exogenous insulin use or primary beta cell failure, as seen in type 1 diabetes. C-peptide levels can help assess how much endogenous insulin they are still able to produce, which is critical for treatment planning. A fasting level below 0.6 nanograms per milliliter suggests significant beta cell failure and may predict the need for insulin therapy. Evaluation of hypoglycemia. When exogenous insulin administration is ruled out, clinicians should consider endogenous hyperinsulinemia. Localization is typically performed through abdominal computed tomography or magnetic resonance imaging. A 72-hour fast or a mixed meal test may be performed to evaluate hypoglycemia episodes. Treatment of hypoglycemia. Immediate treatment for hypoglycemia focuses on reversing low blood glucose. Conscious patients can consume readily absorbable carbohydrates, such as fruit juice. Patients unable to take oral agents should receive glucagon intramuscularly or intranasally. In severe cases, intravenous dextrose is administered. Long-term management. Long-term management of hypoglycemia involves patient education and lifestyle changes. Patients need education on recognizing hypoglycemia symptoms and routine blood glucose monitoring. Pharmacologic interventions may require modification. Patients should wear medical alert identification and carry a glucose source. Prognosis of hypoglycemia. Untreated hypoglycemia can lead to severe neurological consequences, including seizures, brain damage, and death. Patients with diabetes experiencing frequent episodes require adjustments to their medication, meal plans, or exercise regimen. Non-diabetic individuals with hypoglycemia symptoms should consult their clinician. Interprofessional team management. An interprofessional approach is recommended for managing hypoglycemia. This includes primary care physicians, endocrinologists, diabetes educators, pharmacists, nurses, dietitians, and the patient. Patient education on self-management is crucial, emphasizing blood glucose monitoring, medication adherence, and healthy lifestyle habits.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.